Hey, Margie here. Did you know that your immune system can affect your bone health? And oftentimes, this could be one of the root causes of osteoporosis that's so often overlooked. Well, today we're going to delve into this topic with our special guest, Dr. Peter Kahn. And Dr. Kahn supports and manages patients with chronic conditions using a comprehensive approach by merging the exciting advances of functional neurology and functional medicine. Dr. Khan is board certified in integrative medicine, functional medicine, and a board certified chiropractic neurologist. He is the creator of NeuroMetabolic Integration, a science based program that identifies the root cause of autoimmune and other chronic conditions. Over 5,000 patients from across the country have come to seek out his holistic approach that is changing the lives of those suffering from chronic conditions. Born in Taiwan and immigrated to America at the age of 13, Dr. Khan has deep appreciation of the Eastern wisdom and Western advances in natural health care. He believes in the body's ability to heal and regulate itself. And today we're going to talk about how we can master our immune system and beat inflammation and how this can affect our bone health. This is full of great information, so stay tuned. Welcome, Dr. Khan. I'm excited to have you here. This topic is so important and unfortunately so overlooked today. And it's one of the things I see on a regular basis that people just don't realize, aren't tested for, and don't even pay attention to. So, welcome.
Thank you so much, Margie, for having me.
Before we even get into your immune function, autoimmunity, all these important issues we're going to talk about, why don't you tell us why people who have osteoporosis, osteopenia, what is the correlation between our immune system and osteoporosis, and why inflammation, is something we really want to avoid?
Absolutely. No, osteoporosis obviously is a big topic among your audience, but it's a big topic in general because a lot of people struggle with osteoporosis. And currently, osteoporosis really is attributed to various hormone, metabolic, and mechanical factors, non-weight bearing and things like that. However, emerging clinical and molecular evidence studies suggest that inflammation also exerts significant influence on bone turnover, inducing osteoporosis. Okay, so what that means is that we have to understand inflammation, what that is. And most people understand that inflammation is a cause of a variety of disease. In fact, some experts would go as far as to say that inflammation is the cause of all disease. There's a mechanism tying inflammation in either the pathogenesis or as a contributing factor or a vicious cycle that leads to chronic illness of all types, whether it's heart disease, cancer, autoimmune disease, so on and so forth. And osteoporosis is no exception here. So we have to understand what is inflammation in the first place. And to get right to the point, inflammation is an immune system response. Let me repeat that. Inflammation is not just a boo-boo on your elbow. You bang into the wall, ouch, your elbow hurts, it swells, gets red, it gets, painful. Those are the cardinal signs of inflammation. So people associate inflammation with like an injury, which certainly it is. It's associated with injury. However, this inflammation response, whether you twist your ankle or bang your elbow, or you have systemic inflammation, they're all mediated by the immune system. So when we're talking about inflammation, people must understand that it's an immune system problem. Okay. Now, know that inflammation in itself is not a bad thing. If you bang your elbow or twist an ankle, there's a healing response that has to happen in response to that injury. And inflammation is the response to that injury. So it's normal to have inflammation. Inflammation is not, the devil or the thing to be cursed at. It's a normal physiological process after you've been injured. It's only if the inflammation hangs around way too long and gets stuck there and it doesn't resolve, does inflammation become a problem. And it becomes a problem by way of causing various degeneration of, organs and tissue, and really promote this chronic vicious cycle where more inflammation begets more inflammation, begets more inflammation, and turn on various other disease processes, which really all circles around the brain, immune, gut axis, which we can, go into and talk about. So in immune system function, that part of that immune system function is this inflammation process in response to injury or infection can lead to osteoporosis. How does that work? Well, when you're inflamed, your body produces various types of inflammatory cytokines. Okay. Cytokines, as the word says, let me break it down. Cyto means cell, kines means messenger. Cytokines means cellular messenger. So inflammatory cytokines are cellular messengers of the immune system to trigger inflammation. And there are many different classes and subtypes of cytokines. It's a very budding and emerging field of study. But these inflammatory cytokine basically triggers these messages to tell the body, oh, there's an infection here. Send more soldier here to get rid of the infection. Or you twisted an ankle down the right ankle. Send more immune cells there to clean up cellular debris. These inflammatory cytokines has mechanism that actually triggers osteoclastic activity. And osteoclasts, of course, are the cells that causes bone resorption. So there's actually a very strong evidence of inflammatory cytokines triggering osteoclastic activity, therefore leading to bone loss. So we are all kind of stuck on this calcium, got to drink your milk. And, certainly nutrient intake's important. I wouldn't say just calcium. Certainly weight bearing exercise is important. Even hormonal factors, right? It's known that females with, estrogen deficiency can become more osteoporotic. But what's the reason though? What's the mechanism of low estrogen causing osteoporosis? Well, it turns out that in females, estrogen has a dampening effect on inflammatory cytokines. So as you go into menopause or you become estrogen deficient, you'll lose some of that dampening effect if it's an inflammatory cytokine. So you get more inflamed essentially when you have very low estrogen below physiologic levels. And that inflammation as a result of low estrogen is actually what's causing the osteoporosis, not the low estrogen itself. So we're being, kind of focused on the wrong. It's almost like we're focused on milk and thinking of calcium when we should be thinking about vitamin D or vitamin K or thinking about absorption of calcium. We're thinking about stomach acid problem, not absorbing calcium. So there's a lot there that I want to help people to be able to get past the tagline and the slogans and the headlines and really understanding how things work so they can make better decisions for themselves.
I love that. And that's sort of my philosophy. And what I've been sharing with people on the podcast is root cause. We need to look at the whole picture. And so often, unfortunately, that's not looked at. We're just like you said, put a band-aid on it, get your nutrients, don't worry about your digestion, don't worry about the inflammation, or not don't worry. I just don't think people have realized how critical these pieces are to the puzzle. And that if you really want to, and what I always look at osteoporosis as an opportunity to see what might not be person feels okay and they get this DEXA result. What might not be functioning optimally and where we need to look. And if there is inflammation, the good news is when you address it, everything gets better. Things you didn't even realize, were problems. So this is so important. So let's delve into this a little more. So what are the key players in immune function that we want to, really pay attention to?
Absolutely. So, when we talk about immune function, people typically think of immune function as, killing infections. And certainly that's its main job is to survey the environment, your internal environment, to see if there's any infections or pathogens or even chemicals that your body need to be aware of so you can eliminate them. That's one of its main roles. However, when we talk about the immune system, what is the organ that's the immune system organ, right? If you talk about the nervous system, we think about the brain and the spinal cord. When we say the cardiovascular system, we think about the heart. When we say the urinary system, we think about the kidney. So we can attribute like a one primary organ that does that function. But when we say the immune system, like what's that one organ that does that? Well, the truth is there's not one organ that does that. This is the reason why it's called the immune system. It's a multi-organ, multi-player involved in this. So what are some of the main players involved? Well, to start off, your immune system really comprised of barriers. Okay. Think of the castle. You have the walls that protect the castle. So the immune system is the castle that protect, the inner, the citizens inside the castle. So it's made of these barrier, and there's four primary barriers. Number one, the barrier is your skin, right? Your skin is a barrier so that, things don't just like come straight into your body. It's a barrier that protects the inner body from the outside environment. And you'll have the lung barrier, right? So when you breathe air in, you have the barrier inside your lung to filter out particulate matter. So you don't just, have like bad stuff that you breathe in goes straight into your bloodstream. You have actually a lot of lymphatic system and lymph nodes in the lung as well as part of that barrier and immune system to filter out bad things that you breathe in. Okay? And then the other barrier is your gut barrier, which comprises, one of the larger barriers in your body because the gut lining has folds in it that increase surface area. So your gut barrier, because it's exposed to the outside world, is another barrier system. And then the last barrier is your blood-brain barrier, which is a barrier that comprises of blood vessels that separate the brain from the rest of the body. So only certain size chemical can get through to the brain. So these four barriers make up primarily your first line of defense, your immune system. And then there are other players involved in the immune system, such as the bone marrow, right? The bone marrow is actually where the white blood cell and these blood cells originate. So you have to have good bone marrow function. And then once these T and B cells and white blood cells are produced, some of them actually goes to the thymus gland. The thymus gland is an organ that sits right behind your sternum. That actually is where these white blood cells go. They kind of go to school. That's where they learn how to become a white blood cell and what to attack and how not to attack your own body so you don't get autoimmune disease. So the thymus gland is where these white blood cells mature. So that's also part of your immune system. And then you also have your spleen. And then, importantly, it's not just these very straightforward things that you think about, but your thyroid function also play a part in it. Your thyroid hormone actually causes all cells in the body to have proper metabolism. So low thyroid function tend to cause problem with low immune function as well. Your adrenal gland function is also really important. By the way, speaking of osteoporosis, we know that high cortisol states, cortisol is a hormone produced by the adrenal gland, can also be a risk factor for osteoporosis as well. So, we have hormonal influences that impact the immune system. We have, different organ system. We have the gut. So it's not one thing. So I want people to appreciate that it's a multi-system approach. What's the primary thing that we really usually focused on? We're focusing a lot on gut health. We're focusing a lot on just this state of inflammation that your body has from all sources, whether it's gut infections or toxicity or other chronic infections that you can, resolve, or stress even, and even blood sugar from, just dietary influences. So those are the key things that we look at when it comes to immune function.
So let's talk where things go wrong, because so often people have autoimmune conditions when the immune system attacks itself. So why don't you explain? Because I don't think people understand about tolerance and how this develops and why it's really, as you said, it's a very big issue. And I see this a lot with so many autoimmune conditions that people are presenting with, in addition to osteoporosis, not realizing that there is a connection.
Right. So, and that is really important. In fact, autoimmune disease itself is a inflammatory condition. Basically, when you have an autoimmune disease, you have an inflammatory condition, and it's a systemic inflammation. It's not just wherever you have autoimmune attack against. Like if you have rheumatoid arthritis, you don't just have inflammation just in the joints. You have inflammation throughout the entire body. So all autoimmune disease are inflammatory. So at baseline, for somebody with autoimmune disease, you're more inflamed than somebody who does not have autoimmune disease, just at rest, at baseline. And if you have a flare up, then it gets even worse. And that inflammation, again, contributes to osteoporosis. Not to mention, you can actually have autoimmune attacking osteocytes. So you have autoimmune attacking, the cells that produces bone. Then you can have osteoporosis as a result of an autoimmune mechanism. But certainly even Hashimoto's or Sjogren's disease or any type of autoimmune disease, you're going to have more inflammation, which leads to autoimmune disease or leads to osteoporosis. So the question is, why do people develop autoimmune disease in the first place? Well, this is concept of tolerance. Tolerance is not a term of tolerating people, racial, ethnicity tolerance. Tolerance is actually your body's ability to distinguish self tissue from non-self tissue, right? To distinguish, hey, this is my own body. Don't attack that. Here's a pathogen, attack it. Because the purpose of your white blood cell and your immune system really is to kill things. That's their job, is to kill things. Kill what? Pathogens, preferably. But if your immune system loses tolerance, then it loses the ability to distinguish cell from non-cell tissue. Then your immune system starts to point the gun at your own tissue. That's bad news because then you develop autoimmune disease. And once you develop autoimmune disease, it's a tricky thing because your immune system is attacking cell tissue. So what do? Like you can like just get rid of the tissue it's attacking. Like if it's attacking your bone, do you just cut out all the bones that it's attacking? If you have MS, multiple sclerosis, an immune system attacking brain, do you like just take the brain out? You can't do that, right? So that's why autoimmune is such a tricky thing. Can be a very debilitating thing. So why people develop autoimmune disease is down to this concept of tolerance. So how do you develop tolerance? Well, it turns out you actually develop tolerance from birth, right? It's part of the developmental process, just like baby develop, right? They develop the ability to start to crawl and then walk and then run and then speak. Your immune system develop in stages as well. And this tolerance is developed from the time that you're actually born. So by going through the vaginal canal, the birth canal, that's actually the first exposure to your mother's microbiome. Okay, so there's microbiome within the vaginal canal, just like there's microbiome within the gut. So by going to the birth canal, the baby get the swab of bacteria, which inoculate the gut. That actually is the first step toward developing immune system function and developing tolerance. And then when the baby's born, assuming the baby gets breastfed, the first few days you get the colostrum, which is rich in immune factors. And that's basically the transference of the immune system from the mother to the baby through the first few days of nursing with the colostrum. And that also transfer the immune system and develop tolerance for the baby. And as the baby continued to get breastfed, hopefully at least a year, maybe two, then that continued to transfer antibodies and immune function from the mother to the baby. So this is vitally important. So if you think about breastfeeding and natural childbirth, I mean, how many people do you know are born C-section? And how many people do you know that was never breastfed or only breastfed for like a short period of time? That's a lot of people. So all these people didn't really get a chance to build the immune system from the ground up, from the very, very beginning. It'd be like not allowing the baby to crawl or not teaching them how to even sit up, and you're making the baby trying to run or walk before they even learn how to crawl or sit up. Developmentally, you're skipping stages. It doesn't work that great. That's a large swath of the population that have that deficiency. And then as the baby grow up, you get exposed to childhood illnesses, ear infections and whatnot. And as your immune system had to learn how to fight those infections naturally. But guess what? Every time a baby gets sick, what do we give the baby? Tylenol to suppress the fever, antibiotic for the earache. So basically, this is all squashing that immune response and deprive the bodies of, opportunity to learn how to fight an infection. So that this all kind of deprive the body's ability to learn self-tissue from pathogen because you're depriving the body of the chance to fight infections. And that can eventually precipitate due to various other factors that we may or may not have time to get into today that lead to the onset of these loss of tolerance. Now, it turns out that one of the things that determines tolerance is actually oral tolerance. So there's this concept of self-tolerance where your body learns to distinguish self from non-self tissue. But self-tolerance to a large degree is determined by oral tolerance. So what's oral tolerance? Oral tolerance is your ability to tolerate the things you put into your mouth, not having food reaction. So people who have poor oral tolerance are those who have multiple food sensitivity, multiple food allergies. Those people have poor oral tolerance. And it turns out that poor oral tolerance typically will lead to poor self-tolerance, which lead to more likelihood of developing autoimmune, more likelihood of developing more allergies and sensitivities to food, not just food, but also chemicals and environment. So these people with poor oral tolerance tend to be more inflamed, and that inflammation can lead to osteoporosis, but not just osteoporosis, autoimmune disease of various kinds, degenerative diseases of various kinds, like heart disease, diabetes, like Alzheimer's, dementia, Parkinson's disease. So to be sure, this is a big topic. It's not just applying the bone. So really, I see bone health as an indicator of something else not working rather than bone health itself.
Oh, I agree. I mean, the bones are not in isolation. And, so often we segment things in terms of the medical care, but yet it's just part of of the entire body. And as you said, the autoimmune can manifest in different places, MS versus bones versus gut. And what I see so often is, gut issues and issues with gluten and where people are truly reacting and then making a big difference, on their bones and huge. But this is it's such an important point. And, you bring up something that actually like puts a knife into my stomach. Cause prior to, I'm a physical therapist and then I went back to school for nutrition. But I did that after my kids were when I young kids, I hadn't had that education. And so where I lived, I didn't realize at the time my air filter wasn't great. So my kids were constantly having ear infections. So what did they do? Oh my gosh. Two of them were put on low dose antibiotics on a regular basis as a young children. That was the treatment. Either put them on antibiotics, low dose every single day, or you or have the tubes. But they said no, no, the low dose. So of course, my daughter's gluten-free, dairy-free. She's okay now because we figured this out, but had major leaky gut, all those things because what happens, just like you talked about, happens to your immune system when you are given so many antibiotics. So yeah, so
Well,
this
I do want to make a point that that's a really important thing for people to know. When I said that, hey, if you born C-section and born breastfed, that doesn't mean you're screwed for the rest of your life.
oh yeah.
You can still do a lot to recover and to overcome it, to make things better or as it's good as you can. So I don't want people to think that, oh, gee, I guess I'm messed up because I never got that. You can still do a lot. This is why we're talking about it. There are things you can do to improve it.
Oh, that's the best thing. My husband was another one who had an issue and he was coughing, 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 and they put him he's a physician himself, and they put him on all sorts of antibiotics. Anyway, leaky gut, gluten, and, major, autoimmune issues, but no, but, they didn't doctors didn't pick this up. Unfortunately, he's totally fine. Just can't have gluten. So, yes, you can be completely fine once you discover it and take the necessary steps. So, but yeah, you brought up something that is near and dear to my heart, and I think maybe that's one of the reasons I'm such a believer in getting to the root cause and how important this autoimmunity is for your bones as well as your overall health. So let's keep going because you have so much good information. Okay. So we talked about autoimmune disease. Let's just get the brain involved a little bit because I know that's a big part of your programs and it's something that we don't always look into. So why don't you just explain in a little more detail about the brain and the immune system and the gut and and that relationship.
I am actually really spend a better part of the last 15 years studying this because my own family had health issues. But what I've discovered is that seeing a lot of chronic patients, people with really complex neurological conditions, as a board certified chiropractic neurologist, a lot of people come to me with those type of issues, and on top of being inflamed and autoimmune and so forth. So I had a really large practice. I've seen over 5,000 cases in just since 2010. And so I have a lot of experience. And what I've seen is that people with chronic condition all have some commonality. And that commonality is that they have a lot of symptoms involving brain issues and such as brain fog, fatigue. People say fatigue. Is that a brain problem? It absolutely is. I mean, where do you experience fatigue? Like, do you experience fatigue in your buttock? Or do you experience fatigue in your brain, right? If fatigue is a brain phenomenon, you feel tired in your head, that's fatigue. So if you have fatigue, you got to just say, yep, I have a brain problem. That's what it is. Because otherwise, how you're going to focus on the wrong thing. So fatigue, brain fog, depression, anxiety, difficulty concentrating, a low motivation. You walk into a room, you forget why you walk in there in the first place, like short-term memory issues. So these are brain symptoms. And then I also see these people with chronic problem also have a lot of immune system challenges. So what will those be? Those would be chronic inflammation. Maybe they have like polyarthropathy. They have a lot of joint pain all over the place. They have fibromyalgia. But besides pain, inflammation can manifest as simply just inability to focus. Why is that? Because when your brain is inflamed, then your neurons cannot communicate signal and the synaptic firing becomes slower. So you become slower processing. You feel like, man, you used to be like really fast and quick with things. You're not as fast. So you feel like foggy and mental speed is slower. But inflammation can also manifest as autoimmune disease, right? As I said earlier, autoimmune disease equals inflammation and inflammation precipitates autoimmune disease. So you may feel like your joints swollen. You can't pull the ring off in the morning. You may also experience inflammation in the form of or immune system problem in the form of chronic infections. Oh, I have candida, I can't clear. I have like these Epstein-Barr, I always have them, I can't clear. So you may have an immune system that's just not performing up to par, allowing these chronic infection to fester. But the problem is the more you have chronic infection, the more it depletes and saps your immune system. So it creates a vicious cycle. So you may have the immune system problem. And then lastly, people with chronic health problem many times come to me with also gut issues. So then you have gas, bloating, heartburn, reflux, constipation, diarrhea, alternating constipation, diarrhea, or IBS. They may have SIBO. They may have a lot of food sensitivities and so forth. So I see people coming to my office, whether they have, oh, doc, I'm coming to you because I have thyroid problem, or doc, I'm coming to you because I have Lyme disease, or doc, I'm coming to you because I think I have mold, or whatever it is they complain of. They invariably have symptoms in the brain, immune, and gut category, regardless of what they're coming to see me for. So I started scratching my head and said, there's a commonality here. There's a common denominator. What's the connection? Well, it turns out that from scientific literature and research, especially in the past 10, 20 years, we know that there's a brain gut connection. That's pretty well talked about and documented. But what's not really talked about is that the immune system is the go-between between the brain and the gut. So a lot of times people say brain gut connection or gut brain connection. They automatically think that, oh, gut microbiome. So if I don't have enough good gut bacteria, then that's why my brain's not working. Well, what's the mechanism for that? Well, it turns out it's not just like you don't have enough good gut bacteria and therefore your brain's not working. It's that it's all three parts. The brain, immune, and gut it's about a triangle, and they each contribute to each other's function, and it's bidirectional. So it's not just, oh, the gut bacteria, if you just take some probiotic and eat some fermented food, then your brain's going to be better and everything's going to be better. It's not that simple, because you can actually have brain dysfunction that can cause the gut issue and the microbiome to not flourish. Or you can have vice versa, the gut microbiome issue causing the brain function. Or you can have an immune system challenges that can create chronic gut immune system activation, creating gut inflammation. Or you can have immune system problems that can cause brain inflammation. And you can have brain problem causing immune system problems. So it's a three-way triangle. So I want people to be able to start to ask better questions, start opening up the open-minded and think that there's more possibility. Because if you think there's just one way to do it, and that way it doesn't work, then you start to get disillusioned because like, oh, I thought this gut thing is going to fix my brain. I take probiotic and eat fermented food and it didn't fix it. I'm going to tell you that doesn't alone fix it for many people with chronic issues. There's more you got to look at.
So this is also very interesting. And so many of the things that you were saying, I'll see people and they're like, they just attribute that to normal aging. Oh, yeah, yeah, I have brain fog, or yeah, I forgot this. I don't remember names anymore. No big deal. So I think it's just a wake up call to everybody. Yes, do pay attention, and there's things you can do, and everything's connected. So everybody's listening like, where do you start with people? Because it is a bit overwhelming. Oh gosh, all these areas. So what's your recommendation where people should start, or even just share with us how you approach this when you're working with people?
Absolutely. Yeah. So it can be really, and it's not that I'm trying to make it complicated. It's just that it is complicated, right? We try to, and we can make the complicated more simple so we can understand it, which is why I even came up with this concept of brain immune gut axis, which was not really talked about because people all just talk brain, gut, brain, take probiotic, fermented food, fix your gut and fix everything. I want to bring attention to the fact that this brain immune gut is a three-way triangle. So that's complicated, but it's more accurate than just saying brain gut and take probiotic and everything's going to be fine. So how do you take this and practically approach it? That's a great question, Margie. And the way I do it is through this roadmap. So again, just having, worked with so many people, doing a lot of functional medicine lab tests, paying attention to the data, doing pre and post testing, I find these patterns. And what I find is that a lot of people, they're doing things out of order. So it turns out that there's a specific sequence of how you would address a chronic health condition. If you do things in the wrong order, you basically could be doing the right things, but in the wrong order and then get nowhere. The example that I always give is, say you have your phone. We all have smartphones, and you have a password to unlock your phone, right? If the password is say 1234, you go ahead and type 4321. Guess what? It's the same numbers, right? It's all the right numbers. It's even the right number of numbers, right? but it's in the wrong order. Then the phone doesn't unlock. Your body has this priority system where you have to address the most important things first. Another example that helped to illustrate this point is that, in medicine, if somebody is unconscious and you're the medical professional, you come up to this person who's unconscious. What's your first priority? Right? Remember from CPR? First, the ABC, right? Airway, breathing, circulation, right? So if somebody's unconscious, not breathe, and then you go up to them, you find out this person is not breathing and has a broken leg. What do you fix first?
Obviously not the broken leg.
Right. So in the body, there's this priority, right? It's called triage. You fix the most important thing that's going to have the most impact on the whole body physiology. So if you don't address the most important thing, then you're not going to succeed. And the example of this will be if someone has anemia. Anemia is a condition where you have low hemoglobin, low red blood cell, low hematocrit. Basically, you have a decreased oxygen carrying capacity. Literally means that you're choking, right? You're choking off your oxygen supply to your body by virtue of having poor blood quality. A lot of people have anemia and they'll go to the doctor and they'll say, "Oh, you're just tired. Let me give you some hormones. Here, it must be a thyroid. Here, take some thyroid hormone." "Oh, I'm the hormone replacement therapy doc. You're tired. I bet if you just take some testosterone, you're just going to feel better." So they ignore the anemia and they give people hormone. This is an example of how things don't work. Because if you have anemia, basically nothing works. You have to fix anemia first before the hormone, even if you needed the hormone wouldn't work for you until you fix the anemia. So there's this roadmap of step-by-step things that you have to fix. And hormone is actually one of the last things I will look at. It doesn't mean hormone is not important or there's not a time and place to do hormone, in the beginning and stuff. But if you don't go through these checkpoints, then you're going to be taking way too many supplements, fixing way too many things because everything looks like a good idea. Heavy metal detox, candida and hormones and taking adrenal hormones. So you're fixing everything but the most important thing if you don't have this guiding roadmap. And this is really what we talk about in our master classes that we teach is to dive in and teach people, okay, these are the things you need to watch out for so you can have better conversation with your healthcare practitioner and be an advocate for yourself. Be able to speak up for yourself and say, "Hey, doc, you're giving me hormone. Well, what about this?" And maybe they'll start to consider it.
Yeah, it's so very interesting. What a great analogy. Both of those are so it really really lets, puts everything in perspective in terms of why possibly things aren't working. And even if and that's an interesting point that even if you're getting the functional lab test, if you're not doing it in a certain order, it may not be effective, even though it shows. Wow. Wow. So, tell us about this masterclass and what's available to people. And then before we leave, though, you definitely have to tell us the first thing that you test. Everyone is sitting here like, what's the very first thing?
Sure. Yeah. I mean, so I'll tell you what's the first thing I do. The
Yes.
first thing I do with people who come to see me is actually not running the test first. Is actually to have a very detailed consultation, meaning find out, like investigation. What are all the symptoms you have? What's all going on with you? What's your history? How long have these been happening? When did this thing start? When did the second thing start? When did there a timeline, so to speak? Once you have that, then you can use this roadmap approach that I've developed, and then be able to say, okay, based on your symptom and how it fits into this roadmap, how the body naturally works, these may be the top 3 or 5 priorities. Then we go ahead and test the thing that's a top priority for that person. So now like everybody get the same test. Oh, there's a package. Like what's a package? A package means it's cookie cutter. Everybody get the same thing. I don't believe in cookie cutter. Everybody get the same thing. Even if it's a functional medicine lab test, you have to be specific. So before even doing a test, you got to have a conversation. You got to find out. It'd be like go to the auto mechanic who say, "Hey, can you just change out my ignition? What's wrong with your car?" "Well, just change out the ignition. It's not running that well." "What do you mean by not running that well? Is it not starting? Is it sputtering? Is it not accelerating? Is it not braking? What is the problem?" Right? You don't just tell the mechanic that just plug something in and see what happens. This is what people are doing with supplements. They just do random stuff without even doing a very detailed, thorough investigation about what's happening. And the body is infinitely more complex than the car. So, it's not like you can just swap out a part and everything's going to be fine. So again, the first thing I do is ask very detailed questions. So then I determine what type of test that I do. So again, it depends on, if I suspect this person doesn't have anemia, then I'm going to do a CBC with differential and then check iron panels. If I suspect this person have a lot of, digestive issue, I might do leaky gut testing or stool testing to see if they have gut dysbiosis. If this person has a lot of neurological issue, I may, decide to test antibodies against brain tissue to see if there's autoimmune against brain. So it all just kind of depends on what's going on rather than everybody doing the same. So that's what I would do with it, with how I would proceed. Secondly, I think even more important than talking to me personally, right? Because a lot of people say, "Hey, I want to talk to Dr. Khan. This makes sense." More importantly is for people to get the right information so they can educate themselves, right? Because if you are more educated and more aware, then it doesn't matter if you talk to me or talk to anybody. In fact, I prefer people who come to me who already have seen my videos and watch my content because it makes for better conversation. Because I can skip all the basic and explaining and we can just get right to the more important stuff, right? So the way people could do that is by, coming to our masterclass. So we actually have a big immunity masterclass where we dive into the immune system in very much detail. And this is the free masterclass that's going to take place in end of May. And I encourage everybody to register for it. It's a free event that goes on for a week where I have different experts speaking on different topics about immunity. And then I also teach very detailed explanation of different things that makes it useful. Take the complex and make it as simple as possible for the layperson to understand. So that's one way for people to get information that's going to help them. And I'm sure we'll send you the links for your audience to be able to.
Yes, we have everything. So I have a question on that. I love the idea that more than just having all the experts, which is fantastic, so tell us about your teaching part of this. I think that's
Yeah, this is
fantastic.
what I
Yeah.
call a master class. So I don't want to do, it's not a summit where you just interview a bunch of people and everybody have their opinion and there's no like, okay, what do you do with this? How do you tie this all together? I interview experts to kind of talk about a specific topic, but then every day I have videos, which is the master class portion of it is me actually drawing out different physiological pathway, drawing out how the immune system works, showing you diagrams, showing you in descriptions and analogies of how, different very high level concepts work so that you understand how things work. And you can actually like, oh, so this is why vitamin D does what it does. Oh, this is why fish oil does what it does if you understand. And then you can start to say, okay, then I will use vitamin D more in this situation or fish oil more in that situation. So that's the masterclass format. And I think it's much more helpful than just, having an interview of somebody. And then the
Oh,
second people can get a hold of me is literally through my YouTube channel. I have a lot of YouTube videos people can go and find out.
I will put that as well. This is great. I'm really excited. I'm coming to this masterclass because, but I think for people, and I just see this all the time, and that's why I'm just so happy that, to have you here and sharing this because this is missing. It's missing, missing, missing. And it's the good news and the great news. I mean, it's very, first of all, I couldn't agree with you more that you are so empowered when you have the knowledge. It's no longer you can just go to the doctor and they'll tell you what to do. You have to really understand, to really be your own advocate and to figure things out for your best health. And that's what I've seen time and time again. Plus, it's great. It's great to understand. Yes, I'm not just taking this. This is why I take this. This is why I take that. And you're much more apt to feel good about whatever program you're doing because you have all the understanding. So I'm really loving this. And I just want to say how important it is. I see this all the time as a root cause of osteoporosis. And, there's just so many times where someone has had osteoporosis and they figure this out. They see what their issues are. And not only does their osteoporosis get better, their eczema is better, their arthritis is better. So it's just such a win-win when you dig deep, figure it out and have the knowledge. So is there any last minute things that you want to leave everybody with? Because this has just been so helpful.
Yeah, the only thing I would say is, again, thank you, Margie, for the opportunity to speak here on this podcast interview to your audience. But I want to encourage everybody to ask better questions. And better questions will lead to better answers because you can certainly ask the wrong question and get the right answer to the wrong question. You can Dr. Google and find whatever you're looking for. That doesn't mean it's right for you. So, ask better questions. And you do that by, watching interviews like this, watching your podcast, which is excellent, and then be exposed to information and try to have an open mind and ask, okay, what other possibility could there be that could be causing the same thing? It's not usually one thing that causes one problem in your body. It's usually multifactorial.
Great, great advice. Well, thank you so much for taking the time to be here. And I'm excited about this masterclass as well as all of the work you do. So if someone's listening and the masterclass is finished, you always have things coming on and we'll have, links to the YouTube as well. So this is a great opportunity. So thank you for putting that together as a free way for people to really get educated and really get a deeper understanding. So thanks so much. And I'm excited about it and look forward to staying in touch.
Thank you so much.
I love talking to Dr. Khan because he's just a wealth of information. And I hope after listening, you have a better understanding of the link between your bones and your immune system and why it's so important that we address this. And the good news is when you do, not only do you improve your bone health, but your overall health improves as well. And I'm very excited about his masterclass because not only are there going to be some interesting experts, but I love the fact that he is going to give sessions. And he has just a great way of putting things in very easy terms so that we can take complicated, discussions and really understand it. So I'll have that link for you as well as the link to his YouTube where he has all sorts of great information as well. So thank you so much for tuning in, and I look forward to seeing you on the next episode.